Hello, this week I'm really pleased to have a guest speaker, Dr. Tom Richardson, a clinical psychologist researching debt and mental health issues, here to share with us right now. So over to Dr. Tom Richardson.
Hi there.
Hello. So it's really great to have you here and to know that there is a doctor researching debt and mental health issues, and I seriously mean that. Can you share with us why you decided to do this and what you've kind of discovered so far?
Well, I really got into the area because when politicians were debating whether to increase tuition fees for students, nobody was mentioning whether it might have an impact on students' mental health. But I knew there was research there showing, not surprisingly, that students who struggle with their finances, it has a knock-on impact on their mental health. So I started researching that, and a few other things have sprung out from that, really. So it's led to a few other projects as well. So something I did 3 years ago, I did what's called a systematic review, which is where you look for everything that's been published on debt and mental health and sort of bring it all together and statistically do what's called a meta-analysis, where you pool all the results together from different studies. And it really showed there's quite a strong relationship really between debt and mental health. So overall it showed that people in debt are about 3 times more likely to have mental health problems, or looking at it the other way, people with mental health problems about 3 times more likely to be in debt. And this was the case for kind of particular mental health problems such as depression and also things like drug and alcohol dependence.
When I saw your research, I saw, I was so relieved to see that a doctor had researched debt and mental health issues, and that was what prompted me to get in touch with you. And it kind of helped me bring relief to my own problems around depression and spending. So I think for you to be doing this is sort of really honourable and raising awareness to the, as you say, whether it's the debt that causes the mental health issues or the mental health issues that cause the debt.
Yeah, that's very kind of you to say. Thank you. And yes, that's a key thing that I'm interested in, is which came first. So a lot of the research is what we'd call cross-sectional, so it's only at one time point. So it's very difficult to say from that research which came first. Is it that people with mental health problems are more likely to get into debt? It might be through things like overspending when they're unwell. Or is it that the stress of being financially struggling and in debt, does that kind of exacerbate depression and anxiety? So that's something I'm very keen to research, and I've got a few projects on that ongoing. One of the ones I have published was with students, and it was looking at financial difficulties and their risk of an eating disorder. So not necessarily diagnosed with something with anorexia, but kind of how risky they were in terms of how preoccupied they were with their body image, whether they felt controlled by food and obsessed with their weight. And what we showed when you followed people up over about a year is that those who were struggling more financially at the start, they had sort of greater eating disorder risk at follow-up, after you'd accounted for how great their eating disorder risk was initially, suggesting that the financial difficulties did kind of exacerbate this risk of an eating disorder. But then when you looked at it the other way, those who were at greater risk at the start, they struggled more financially sort of 3 months later, after you'd controlled for initially how much they were struggling. So this is really one of the first times that there's kind of scientific evidence of a vicious cycle, which makes sense.
Yeah.
You know, if you speak to anybody who's been in the situation, they would talk about it being a vicious cycle where you're in debt, that makes your mental health worse, and then you avoid paying the bills, etc., and then that kind of becomes a vicious cycle. But we're really only just starting to tap into exactly what causes what. And one of the other things I'm keen to do as a psychologist, I'm biased, is look at the psychological kind of processes which underlie this, because a lot of the research that's been done is maybe from like an economics point of view, which is brilliant, but I think it's missing out the psychological side. So why is it that when you're in debt that exacerbates your mental health problems, and why is it that maybe if you are mentally unwell, your finances are more likely to go awry?
Yeah. And I know for me personally, when I was emotionally unwell after a series of unfortunate events in my life, sort of going through traumatic situations, I know for me that shut down my logic, and I was sort of emotively driven. So, regardless if I could afford to spend or not, those emotional drivers or the need to search for fulfillment, if you like, overpowered my logical budget sheet. And I really had to learn to get to grips with my emotional drivers and explore the underlying issues that were triggering me to spend, which is a tough journey on your own. But to know there are people like you doing research on it and bringing some more light to the situation and raise more awareness on it, seriously, I think it's just absolutely honourable.
Oh, thank you.
From here, I would just like to for you to emphasise maybe where people could find out more about the research that you've done. So there's something I've done which you can search for. I've got an information sheet on debt and mental health, which summarises stuff. It's for students specifically. Okay,
but if you kind of Google me, there's also a kind of a presentation I've done summarising the kind of science and psychology of debt and mental health, which sums up other people's research and my research and some of these possible psychological mechanisms that might have an effect on this relationship. I've got stuff ongoing. There's lots of good information out there. So I think the main thing really for people, if they think that there is this relationship between their debt and their mental health, is you've really got to try and get help with both at the same time. If there is this vicious cycle, you're only going to get so far if you get help for your mental health but leave your finances, or get help for your finances but don't go to your GP about your mental health. You've got to tackle both at the same time.
Absolutely, totally agree.
Or else it's like having someone who's depressed who's drinking too much.
Yes, yeah.
They can stop drinking, but if they're still depressed, that's going to make them drink.
Yeah.
Or if they get help for their depression but they're still drinking, the drinking's going to... You see what I mean? So
I do,
it's
yeah.
exactly the same. So that's my main bit of advice, really, is just try and get help with both.
That's really good advice, because it equally relating to my journey. I know I was tackling the debt and tackling the mental health issues that I kind of subconsciously knew the triggering it was a scary place to go. So I thought I could solve the solution by just addressing the debt. But all that done was build the debt and build the unaddressed problem. So that's
it's kind
really
of tackling
good
the main symptom but not the kind of underlying...
Yeah. So I had to get brave enough to delve beneath the surface and look at the underlying issues that were laying unaddressed. So then my kind of iceberg began to melt and life began to get better again. But it's an ongoing thing.
At the same
yes.
time, exactly.
Well, eventually, yes.
Eventually, yeah.
Which has brought me here today. So there's now a kind of like an upside to my journey. And now being able to help others and to know there's other people out there as well is just absolutely a relief. So thank you.
Thank you for having me.
And thank you for tuning in and listening, and we'll see you again soon. Thank you.